Serious. Doctors of Reddit, what is the rarest disease that you've encountered in your career? Jokes, puns, and off-topic comments are not permitted in any comment, parent or child. Parent comments that aren't from the target group will be removed, along with their child replies. Report comments that violate these rules, posts that have few relevant answers within the first hour, and posts that are not appropriate for the serious tag will be removed. Consider doing an AMA request instead. Thanks for your cooperation and enjoy the discussion. I am a bot, and this action was performed automatically. Please contact the moderators of this subreddit if you have any questions or concerns. Objective tinnitus. I could lean close to the patient's ear and hear a ringing noise coming out. Central deafness. Patient had an anoxic brain injury and was essentially deaf even though there was nothing wrong with his ears. Patient admitted for something unrelated, starts deteriorating for no discernible reason, has some mild generalized abdominal pain, but other than that no specific symptoms. However, he keeps worsening to the point where he's barely hemodynamically stable. On the abdominal contrast cord, there's fluid everywhere, organs pushed against the abdominal wall, just one enormous gray puddle from the top of his pelvis to his diaphragm, and then, at some point, there's a scribble of white pretty much smack dab in the middle of it all. In this context, signifying active bleeding, it was shaped like the world's smallest firework pop, and it was nowhere close any major vessel. Everyone was dumbfounded for a hot minute. It turned out to be a spontaneous, traumatic rupture of the cystic artery. No surgeon in the building had ever seen one. Dude underwent embolization and made it out completely unscathed. Fibrodysplasia ossificans progressiva, FOP, a disease that calcifies soft tissue and turns it into bone. When I was a medical student, our group's cadaver had this disease. During dissections we sometimes would get poked by spiky pieces of bone in random areas of her body. Also had a spine that resembled a small turtle shell. Maybe not the rarest, but saw a 4 or 5-year-old patient with Lesch-Nyhan syndrome on my PEDS rotation in med school. It's an X-linked recessive disease that a quick Google search tells me affects about 1 in every 400,000 individuals. It's due to a mutation in an enzyme involved with DNA recycling. The thing all med students remember about it is for whatever reason these patients have a tendency to self-mutilate. My specific patient had to have a procedure to have all his teeth removed because he would terribly bite his arms unless he was physically restrained. I believe he had an older brother that went through the same ordeal. So sad, but definitely one of the more memorable cases from med school. Dermatologist here. Some fun ones. Chromidrosis, where sweat comes out in different colors. My patient's was blue. Argyria, a permanent discoloration from silver overdose. Aquagenic urticaria, an allergy to contact with water. Persistent genital arousal disorder, having multiple orgasms a day, at any time, without any stimulation, becomes quite bothersome and uncomfortable, limits your daily activities and sleep is interrupted. Over time patients can become very hopeless. It is remarkable the dissonance between the name and the obvious joke, and the tremendous suffering these patients endure. I diagnosed the patient with cancer of the parotid gland. It has an incidence of less than 1%. It went something like this. He came to me because he was having right jaw pain. I assessed him and nothing was really out of the ordinary. I thought he was having some TMJ because he had been dealing with some stress and he did have pain at the trademark joint. A week later he came back with a Bell's palsy, which is a temporary paralysis of one side of the face. This can be caused by inflammation or a viral infection. So I asked the appropriate questions and he had some upper respiratory symptoms the week before, but something was off. So I palpated his jaw again and moved more medially towards his cheek, and he said it was painful midway on his cheek, where his parotid gland was. There was something there, not a discernible mass, but something was off. That's when I ordered a cord scan, and it was confirmed. I got him to a head, neck specialist along with getting him to a cancer specialist. He's currently 2 years out, and although he's missing some of his face due to surgery, he's doing surprisingly well, and his spirits are great. Wow, I did not expect this much traction and interaction. I'm doing my best to respond to comments, but I've been on mobile and it's been tough. So if I didn't respond to your comment, I really do apologize. It wasn't intentional and I don't want anyone to feel slighted or bad. Thanks again for the amazing conversation and the incredibly kind words. Hope each and every one of you are in good health and spirits. Rarest disease that I've seen in my career thus far would have to be leprosy. It's something that one hears about in antiquity and something I read about in books, but I never expected to actually encounter it in my career. Geneticist here. I work in a pretty big hospital and we get hard to solve cases from all over the world. Some of the cases are so unique, there is literally no name yet the genetic disorder, so those would be the rarest, but for the sake of this thread, I will discuss something that is not the rarest, but is pretty rare, and one of the most interesting. Prader-Willi or Angelman syndrome. These are two extremely different disorders that are both caused by the same exact genetic mutation. The only difference is if the mutation occurred on the paternal chromosome or the maternal chromosome. If it occurred on the maternal chromosome, you get Angelman syndrome, which typically results in the child being overly happy, laughing all the time with light eyes and hair color, but also severe intellectual and physical disabilities. If the mutation occurred on the paternal chromosome, you get Prader-Willi syndrome, which results in the child having excessive hunger and can literally eat herself to death, but with only mild cognitive disability. These kids may go a very long time not getting diagnosed and will become quite obese. Bonus disorder if you're still here. Williams syndrome. With this one, the affected individual has an extremely charismatic, outgoing and fun cocktail party personality. They are cognitively impaired in most aspects except for speech and have very unique facial features that are described as elf-like. Nurse here. I've unfortunately seen fatal familial insomnia, also seen Brugada syndrome, edit, also seen Necfasca bunch, transient global amnesia, good postures, Steven Johnson syndrome, psychopathy. I guess I didn't see it. Some other unusual stuff that isn't coming to mind. Nursing can be a shit job, but you get some cool stories. Malignant hyperthermia in my 11-year-old patient. I was only in my second year of anesthesiology residency and I thought she was going to die. I had a salty old anesthesiologist as my attending and she calmly led the whole team through the treatment. My patient did great and her labs were all normal when I took her to the PEDSICU. I couldn't sleep for 2 nights and still haven't gotten over it. A marginal ulcer. It's a type of cancer that grows on damaged skin, mostly burnt skin. I handled a patient with one on junction where her neck and back met. I was the anesthesiologist, and the patient can't lie down flat due to the pain, which made placing an endotracheal tube way more difficult. This is a picture of the patient. Rarity varies a lot by discipline. I'm in general surgery, so I see things like foreign ears and Necfasca pretty regularly, but have never treated an ear infection in my whole career. That said, strangest presentation for me so far was a gentleman who had an anti-reflux procedure on his stomach and esophagus, Nissen fundoplication with a hiatal hernia repair, then had a recurrence and got a redo which required a procedure to lengthen part of his stomach, cholecystoplasty. After that procedure, you have a staple line in your stomach. His hiatal hernia recurred again, bringing his stomach back into his chest and he formed a connection between his stomach and the sac surrounding his heart. He presented to the emergency department dying because the gas and stomach contents could get into his pericardium, but not out, and his heart couldn't expand adequately to pump. Mad props to the ed doc who figured it out and saved his life before shipping him to me. Smile. I had a patient who presented with purple, silver skin. He looked like a Smurf and the Silver Surfer had a baby. However, he was in the ER for abdominal pain and was highly offended when I asked him about his skin pigmentation. My first impression from across the room was that he was severely hypoxic, and I was amazed he was walking and talking. He made comments that made it appear he was a huge conspiracy theorist, so I was suspicious of colloidal silver toxicity. When I asked him about it, he shouted angrily, "I don't take silver supplements anymore." After some prying, he said he took them to self-treat for a prion disease which he self-diagnosed from the grape juice test, where you spit out grape juice into a petri dish and a fungus grows out of it. At this point, I'm like, yeah, this patient is fucking nuts. I'm pretty sure he listened to too much Alex Jones and as a result permanently dyed his skin blue, a condition called argyria. On my OB rotation during a residency, I helped deliver a baby who had spots all over. Further blood testing revealed the baby had developed leukemia while in the mother didn't know that was really possible prior to that day. Incredibly rare. Clinical lab scientist here, doing the testing. I once saw mold growing from a brain tissue. Patient was immunocompromised. He eventually died, but not before pretty much every piece of tissue submitted for culture grew fungus. The type of mold growing was common environmental flora, Alternaria species. We had a patient once, a young girl, who was so sick that it broke our data analysis pipeline. When the code ingested a genome sequencing sample, it attempted to detect the chromosomal sex of the patient. It was using two metrics. The sample was considered female if it, 1, lacked Y chromosome, and 2, was heterozygous on X chromosome, implying there were 2 copies of it. Otherwise the sample was considered male. This one sample registered as female on metric 1, no Y chromosome, but male on metric 2, very little heterozygosity on X chromosome, which was not anticipated and resulted in our pipeline crashing. Upon investigation, it turned out that the parents of that poor girl were brother and sister to each other. As a result, she had very little genetic variation throughout her genome, not just X chromosome, and was consequently very sick, with a plethora of diseases typical for consanguineous births. See LN6. Only about 125 cases described in the literature. My brother has the disease and I am a carrier. His diagnosis was unknown until I had extensive genetic testing done prior to fertility treatment and found I was a carrier. I'm also an MDoc, driven initially by my desire to figure out what disease my brother had. I have seen VCJD. There was a small cluster at a hospital I trained that thought to possibly be associated with wild game. I also had a patient with Lee syndrome. Nursing student, but scurvy. We don't see it very often because of the widespread of vitamin C in most foods. Patient had OCD plus agoraphobia, making their diet extremely limited, and never left house, so mostly noodles and instant ramen 1 meal a day. Was eventually found almost dead with no teeth by a wellness check when neighbor thought he was dead after not hearing him moving around flat in over a week. My dad has a very rare mutation of Crohn's colitis. He has infectious tunnels connecting some of his organs together, but a few of them missed organs and came through his skin. Has seen a lot of specialists and none of them had ever seen or heard of someone like him before. It left him in pretty rough shape for years before I was born and during my early childhood. Medicine is improving though, and he is on some fairly experimental treatments that seem to work well. One infuses his blood with proteins from mice, and even a few works were published on his case. The man's had it rough right from birth, but his regular treatments keep his condition stable. Hopefully this'll help the folks who work with him learn how to treat future patients. Smile. Edit. I don't actually know much more about it than what I originally stated. We aren't all that close, and this is what my mom has shared with me about it. I'm a patient, and I was diagnosed with WPW after a brutal hit to my chest while playing football. It took 2 catheter ablations to correct the problem. Both doctors and the hospital staff have never seen anyone diagnosed with WPW in their teens, so I was recovering around people in their 60s and 70s. It was a life-changing moment. If you're a cardiologist in Northeast Illinois, McHenry, Lake and Cook County, you may have saved my life. Thank you all and Godspeed. Med student here. This happened in my first year of med school, when I was learning physical exam maneuvers. We learned to examine from the patient's right, but in this case, the senior medical student in the room with me was at the patient's right. I started auscultating the standard APTM spots for the heart, but I performed them from the left side. When I had concluded the exam, I said I heard normal heart sounds. The senior student told me that I had auscultated in the spots opposite of where I should have. He then performed them properly and looked puzzled when the heart sounds seemed displaced. It turned out the patient had dextrocardia. Rarest? Off the top of my head, I don't know. I did see a woman with psoriatic arthritis type 5. It's an autoimmune disease. It had basically disintegrated all her fingers to nubs. They had the exact shape of short, stubby sharpened pencils. I think it's called distal interphalangeal predominant psoriatic arthritis, and the pics I googled still don't do it justice. She looked like she had sharpened pencil stubs for fingers, like strange little claw hands. I was an intern at the time. The woman laughed at my amazement. She was obviously comfortable with it at this point. Attended. I got the precise name of the disease wrong. Somebody below pointed out to me that it's actually a more severe form called psoriatic arthritis mutilans. While not super rare, my young daughter was diagnosed with pediatric Graves' disease and was on the verge of having a heart attack. She was 10 at the time I took her to the clinic. The doctor asked us if we could allow the pediatric residents to come in and view all her symptoms: a disease, massive thyroid and very high BP. I tried to make jokes about scaring the residents when they came in, but I was pretty terrified. 30-year-old African-American in active labor with about 5 family members around her. I am the pediatrician at bedside waiting for the baby to come out so I can examine him. He comes out and all of his poor little distal limbs are severely disfigured or missing digits. Turns out he had intrauterine amniotic banding. Pieces of the amniotic sac get wrapped around limbs and digits. This causes strangulation of the blood flow and prevents development. Worst thing I have ever seen and 1 in 1 million chance of happening. But Mom took him in her arms and loved him all night long as if nothing was different about him. Rare and interesting would be pathology of Cantrell, which has the heart outside of the chest because the sternum has not fused. I'd seen it before with just a bit of the heart on view, but with this kid it was completely out. You could see pretty much the whole heart with the aorta and lung vessels, all that was holding it, the heart just beating away. I'd done adult cardiac for a bit, but this was a little different. Tiny. We covered it with a polystyrene cup until the kid went or theater to have it pushed back inside. It's meant to be 1:65,000 live births. Hutchinson-Gilford progeria syndrome. Takotsubo syndrome. As a woman was at her husband's funeral. Stiff person syndrome. I only diagnosed the Takotsubo, but was on the team in the early treatment of the other 2. Stiff person was idiopathic as far as we could tell. During an acute attack it was a real bugger to treat. There's very little literature or guidance. Psychiatrist here. Anti-NMDA receptor encephalitis. The body starts attacking its own NMDA receptors and patients often present with psychiatric symptoms, catatonia, and seizures. DID, dissociative identity disorder, aka multiple personality disorder, is supposed to be super rare. But I consistently have patients with borderline personality disorder who want to believe they have it. I am not convinced I've ever seen a patient who actually had DID, not sure if I believe it is a real condition.